Hey, good morning, and welcome to the UroPatient podcast. We got a special episode for you today. You might notice I got a different shirt on. Of course, hard to see with the microphone in my way, but it's our Blue Monday shirt because this we're going to be celebrating Prostate Cancer Awareness Month, and I thought I'd have an episode that kind of filled you in a little bit on prostate cancer awareness. So, if you're watching us live, you can watch us on any of those channels. Glad to have you on board. We come to you every Saturday at 10:30 a.m. Central Time. So let's get right to it. I'm going to talk to you a little bit about what you should know about prostate cancer. So it is Prostate Cancer Awareness Month and started September 1st, ends at the end of the month. What is prostate cancer? It's a form of cancer that develops in the prostate gland, which is that small walnut-sized gland that produces the fluid that comes out when you ejaculate. Early detection is what's crucial. So we observe it, as I mentioned, it's observed throughout the month of September. And the real aim of it is that it should help you to increase your awareness of prostate cancer and encourage people to get screened for it, most importantly. Statistics. Well, it's the second most common cancer in men worldwide. Early detection can lead to better treatment outcomes. And risk factors are age, family history, race, diet, etc. So how can you get involved in participating in Awareness Week? Well, you get screened. That's the most important thing. Annual screenings for prostate cancer, especially at the risk. And for patients that have had a family history that is early as 45 years of age or earlier sometimes. And normally we start in at 50 years of age for most men. And if you have prostate cancer, use social media to share your story. I think it's always best to do things as a shared group. And then, of course, supporting research into prostate cancer, donate or volunteer with local organizations. I'll mention a few of those later on that you can get involved in. So what are the signs and symptoms? Well, sometimes it can be some difficulty urinating, bone pain. These are things that we typically see later on in prostate cancer, but early stage prostate cancer typically has no symptoms at all. So you may not even know you have it. So how do we screen for this? Well, the number one way we do it is with this test called the PSA, Prostate-Specific Antigen test. And that will give us a reading to say whether it's normal or if it's abnormal. Now, it doesn't tell you you have cancer or you don't have cancer. Digital rectal exam, you can feel the prostate to see if it has a little lump or nodule with the finger exam. That bump can sometimes give you the clue that you need to test, or the abnormal PSA. Either one of those are abnormal. The next step typically is going to be a prostate biopsy. Now that's changed a little bit. There are some of these new biomarker tests that may be done to help distinguish which PSA elevations are high risk and which are low risk. We've talked about that before. But anyway, we'll try to delve into that more. So if you get prostate cancer, what do you do? Well, there's a lot of options now. We can do what's called sometimes, and it depends on the treatment of depends on the stage and grade of your cancer as to what the best treatment will be. But sometimes you just watch it, keep look at the PSA, see what it's doing. Call that active surveillance. Different type of surgeries. Now, most of prostate cancer surgery is done robotically, but it can be done traditionally or other methods. Radiation therapy, which involves no surgery, can have very high cure rates for this. Hormone therapy is utilized in shrinking the prostate, and there is even chemotherapy that can be utilized. Lots and lots of ways to treat it. There are things you can do with lifestyle changes that can help in preventing prostate cancer, such things as low-fat diet, more fruits and vegetables. Exercise. Regular good physical activity is great for every prevention, all cancers, including prostate cancer, heart disease, stroke. It's recommended that you should be getting at least 30 minutes of aerobic. Now, aerobic means you're getting your heart rate going faster. So about 30 minutes of that. Now, that can be done walking really fast, running, swimming, bicycling, which is what I do every day, my favorite exercise. But do that, and it can help prevent this. And of course, don't forget your regular checkups. Now, there are a lot of resources you can find and support. There's websites that are all over the internet that you can look at. some local support groups, hotlines, and of course, your local urologist will have more information. And here's finally a list that I put together of some of the ones that I think are really good to look into if you're looking for a place. So Prostate Cancer Foundation, Zero, the End of Prostate Cancer. I do a lot of work with the Zero group. The American Cancer Society, of course. Us Too International, nonprofit organizations, provides education for prostate cancer. The National Comprehensive Care Cancer Network, all types of cancer, and the Men's Health Network. All these are really good sources, and I recommend that you go ahead and check any of those out. Prostate cancer can be a curable disease. That's why we recommend early diagnosis and treatment of your prostate cancer. So don't be afraid to come in and get checked out. Make sure you have that check done every year. I've been having it since I turned 50, so it's important to do. And boy, I've seen a lot of friends, now my age that have come up to me and said, hey, I've got prostate cancer. What do you think I should do? And, they're always looking for some help. So lots of things out there to get help. And the UroPatient podcast, great place to check out every week to learn more about what you can do for your